Hey everyone. Perhaps there's a question you've had, which is how much does my risk of stroke actually go up as my blood pressure goes up? It's a mysterious question, and I'd like to give you a concrete answer here. The results I think will surprise you. I'm Dr. Omar. Welcome to my channel, and I just wanted to let you know that this is not medical advice. This is for general information and entertainment purposes only. Why does hypertension matter? Hypertension is just another word for high blood pressure in medical lingo. Why it matters is it does lead to stroke as well as other things such as a heart attack. And a heart attack and a stroke are very similar. It's just that they're in different parts of the body. You could think of a stroke as a heart attack in the brain or in the central nervous system. When you have high blood pressure, you can't really feel it. So sometimes your subjective experience will match what's going on in your body. Like, for example, if you have an injury from a mechanical injury, or if you have even a skin cancer, normally you'll know that it's getting worse. But when your blood pressure goes up, unless it's extremely high, there's often no symptoms. You can't really trust your own experience. You have to look at the numbers. You have to look at the blood pressure meter and what it says. So that's one of the reasons why it's a silent killer. A very high number of people in the world and in America have high blood pressure. It's undiagnosed. The other thing is the increased risk of stroke even starts at low blood pressures, things you might think of as pretty low blood pressures. 115 over 75, typically we say 120 over 80 is normal blood pressure. But even at 130, 140, we have a higher risk of stroke. And the vast majority of stroke is preventable. It's one of the most tragic things is having a heart attack or a stroke, but it is preventable. The vast majority of them are. And about 54% of stroke is due to hypertension. So if you've known someone who's had a heart attack or a stroke and you feel empowered, hopefully this information can help you reach out and help others around you and also maybe help yourself. The question is, how much does stroke actually go up for every 10-point increase in blood pressure? When you go to your doctor's office, you'll be given a number, 130 over 90, 140 over 100, and normally the numbers go up by every 10 units. I'm going to show you two studies, and so here's this from 2013, and it's on blood pressure control and primary prevention of stroke. What it does is it summarizes some clinical trial data and what's called a meta-analysis, which is a study that summarizes other studies. And what did it show? As with many things in medicine and science in general, you want to get a number of readings before you come to a conclusion. You want to triangulate the problem. Now, looking just at the elderly, isolated systolic is the top number, like at the 120 over 80. Hypertension means blood pressure. 11% increase in stroke risk and a 16% increase in all-cause mortality, basically just dying of for any reason. For every 10 milligrams per mercury, that's a unit of blood pressure. Milligrams of mercury is basically the 120, 130, 140 over 80 or whatever. So for every 10 units of blood pressure that goes up, you have an 11% increased risk of stroke and a 16% increase in dying of for any cause. That is an extremely high number for a very small change in blood pressure. So if I told you that if you go on this flight, you have a 16% chance of dying, you might say, heck, just give me my refund. Or you have an 11% increased risk of a stroke. If you enter this room, walk into this room, you would never do it. That's a good estimate to start with. Now, let's look at another study. This one is out of China, where they looked at blood pressure with a stroke risk, and they had all kinds of other information about age and income and other things that stratify people. So what we see here is a nice, interesting chart. This is the most juicy chart in the study. As you can see here, the most important thing to look at is these are the numbers, 130, 140, 160, 180. And really what it's measuring is 130 to 140, 140 to 160, 160 to 180, and above 180. So if your blood pressure is less than 130, the top number, they say that your risk is basically baseline. That's their baseline where they start their estimates. If your blood pressure is between 130 and 140, you have a 1.11 increased risk of stroke. It's actually an 11% increased risk just by going up 10 units. So less, like say 125 to 135, you have an 11% increased risk of stroke. Now, if you look at the next one here, it's 140 to 160, you have a 58% increased risk of stroke. And if you go from 160 to 180, you have subtract 2.56 from 1. So it's 156% increased risk of stroke. And then if you have above a 180 on the top number, you have a 208% increased risk of stroke. So As you go up, you have a dramatic increase in stroke. Let me quantify this a little bit better for you now. I'm taking the information from this chart, and what you can see here is we talked about the 11% increase. If you went up from 140 to 160, it said 58% increase. So for a 20-point increase, you went up by 58% on average, of course. These are all estimates. So you can estimate that for every 10 units of blood pressure you went up, when you're in this range, from 140 to 160, you have a 23% increased risk of stroke. So what we're noticing is that the risk of stroke goes up for every 10 points you go up in your blood pressure. So it's like the first 10 points, wow, 11%. Now the next 10 points, the risk is not just another 11%. It goes up by 23% on average. Now, if you go to the 160 to 180 category, you're at 156% increased risk of stroke. So for 40 points of blood pressure, on average, your risk went up 156%. So now you're looking at a 39% approximately for every 10 units of blood pressure that are high. The first interval, you increase your risk of stroke by 23% as you went up. But as you increase your blood pressure more, you get a higher and higher risk. And wow, at above 180, you're at a 208% risk of stroke. These numbers are very concerning, and they get worse and worse as the blood pressure gets higher. So it's not a small risk, it's a huge risk. So the conclusion is even 10 milligrams of mercury being high increases your risk of blood pressure, and this risk goes up dramatically as the blood pressure goes higher. So be afraid, be very afraid. Now, what can you do? You should have one of these home monitors in your home. Again, not consumer advice and not medical advice, but it's a general recommendation that we can make based on this data. You can get them online fairly affordably for under $20 to $25. So weekly monitoring is very important. Make sure it's the same time every day, and make sure you're seated for a couple minutes before you measure it. You should also know the symptoms of a stroke, because you can save someone's life, you can save your own. And also, of course, you want to ask your doctor or other clinician if medications are indicated in your case. Most people show up to their clinician, their doctor, when it's too late. So you want to get ahead of these things. Here are some of the symptoms of a stroke. The acronym is BFAST: balance, loss of balance, coordination, or dizziness, eyes being blurred vision, asymmetry in the face. You notice one side of the face is drooped, weakness in your arm or leg. Normally it's on the same side of the body. Difficulty speaking, this is probably the first noticeable symptom. For some reason, where strokes often happen in the brain, for some reason that's anatomical that we can't go into here, oftentimes the problem arises in an area that's related to speaking. Speech difficulties is a very common sign of a stroke. Headache as well can sometimes be a sign of a stroke with no known cause. So it's important to understand these symptoms and understand that you can't tell when you have high blood pressure. Thank you very much. I hope this has been helpful for you and those that you love. If you found this helpful, we appreciate it if you like and subscribe to our channel, and check out some other videos. Take care.